system at the same time. But the problem is here. We are not the robotics persons. We are biological people, and we don't have a magnetic spaces in our bodies. So we need to solve this problem. How are we going to solve this problem? Do we have a contrast agents, magnetic contrast agents? We have. We are using in MRI technology to magnetic agents. So we can coating these magnetic agents like antibodies or other parameters or platelets, and we can inject our vein systems. And when we're using the ultrasound system with combine the magnetometric, we can see the better resolutions. Here, this is the ultrasound imaging that shows that colon carcinoma patients, that these areas are colonic, they are all covered by the tumor tissues. I'm sure that in a close time, in a near future, we're going to use these for the clotting formations in emergency department. And the other things I'm going to explain you, the photoacoustic imaging. As you can see, there is lots of, this imaging technique is very powerful to detect the vascular situations to patients. So this light wave is very, has good penetrations to tissues. Therefore, actually this principle of the imaging system is based on the hemoglobin and hemoglobin oxygen saturations and desaturations. Here, cardiac anterior wall oxygen saturations at the same time, ultrasonographic imaging and the photoacoustic imagings, they are saying that this is the red area. It shows that the oxygenization cardiac tissues. So in MRI, in MI patients or the problem suspected cardiac patients, we can use echocardiography with these techniques. It's going to be really helpful, and it's going to be really good diagnostic devices in emergency departments. And also dual energy CT. This CT is really important, and it's going to be, there's a commercial CT is available right now. There's a two detector here and two energy photons here, low energy and high energy. They combine their imaging in the same time. And as you can see, this is the normal X-ray, normal CT imaging, and this is the perfused blood volume. As you can see, the inferior lobes of pulmonary lungs is not good perfusion. You can see another imaging techniques like it's very clear, and so in soft tissues it's very clear imaging parameters you can see there. And other things, in emergency department, we don't like to send the patients to MRI imaging. So is it possible to MRI imaging, portable MRI imaging in emergency in red side of the hospital? So we can use it. This is the commercial devices also, you can buy it. It's the portable devices. And this is the devices imaging. As you can see, the SOC is standard of care imaging. This is the real MRI imaging. The same patients, this parameters is real imaging, MRI imaging, and the other parameter is P is representing the portable. This portable MRI imaging shows. Actually, it's improving itself very fastly, but the imaging is really promising that they're going to be used, and they can be really helpful to diagnose the patients in emergency. And also, this is the 1 minute video. You know, in emergency departments, we withdraw blood too fast and too much. So to develop new technology, it's better. And if we don't use this technology to persons, it could be much more safety for the blood contaminated diseases. These devices used at the same time laser technology and the ultrasound wave, and it's withdraw their blood.
Dr. Ertuğ, you get 3 minutes.
And of course, the prize is really important. The 30 grants, 30,000 prizes, and the person's in a annual value is $27,000. So if you buy this is going to be helpful. It's going to be much more cheaper than you. Then of course the humanoid robotic nurse is going to be, or in daily practice we're going to use the humanoid robotic nurses, and of course in a distant future I'm not sure that we're going to see this much in our daily life, but there's a tiny robots, nanorobots going to come here, and they're going to clean the clothes inside of the vascular systems, or they're going to deliver the drugs directly into the clothes or something else. Future is coming, future is running, we are running to future, so we need to update ourselves and we need to update our devices. That's all I'm going to explain today.
Thank you very much, Dr. Kemal Ertuğ. The last speaker of this session, Associate Professor Mustafa Keşaplı, please.
Good afternoon, everyone. I want to speak about the impact high technology in quality and safety. Two speakers before me, they two of them so good summarized, but I want to just summarize the rest of the important innovations. Also, I will show you just this presentation is, I am just fast a little bit going, and this is on. I will speak to you end of this presentation. I will explain to you, you see that the innovations in emergency medicines and some words, some literature, some text also was here. So this is almost 14 PowerPoint presentation was it. It was produced by ChatGPT. It means that this is the most important thing is you are writing some words onto the computer and then you are producing some text, some presentation. So this is the most important innovation, I guess, in science. So this is also good, and the other one is bad. It's up to me, it's a little bit strange. That's I emphasize to you, ChatGPT is coming, and the most important innovation in medicine, I guess, up to my opinion. So let me introduce my presentation, my real original one. So in quality is, World Health Organization described as prevention of errors and adverse effects to patients associated with healthcare. So when your medical care is so complex, your medicine is so more, so greater use of new technologies, all the safety and quality is also to be a little bit difficult to provide. So some benefits of innovation emergency care: quality, safety, efficiency, patient satisfaction, outcomes, recovery, effectiveness, and reduce to the medical errors, delays, cost, complications. So it also improved the skill to the personnel of our training certifications, our healthcare providers, professional development for them. So also pre-hospital, the hospital also improved the policies of health system and societies, it improves. So also, what was the limitation of the innovation in emergency care? These are some complex technical issues, so regulatory and ethical barriers, especially in countries and regions of the world, so cost and accessibility, user acceptance satisfaction. You have to implement it to the new device, new training, new methods to your EDs, your hospitals, your healthcare providers, your decision makers. It is so sometimes so difficult. So you have to be adapted to the emergency care system. So some of the innovation in medicine, I want to summarize to you one by one. First of them is electronic recorder or health information, medical record technology. So we are working in emergency departments. So we are finding in ambulances some patients, we don't know about their history, their medical allergy, their nothings we don't know. So we need some medical records of them. So it gives to us the health information records technology. It gives to us complete and accurate patient information, especially in life-threatening situations. So it was reduced to the medical errors, improved the patient safety. Sometimes we are using barcoding and scanning technologies. Up to me, it's one of the best examples in all of the world, enabled system in Turkey. It's a kind of, we are using that. When you're giving to the ID number of the person, we see all the person's medical history. So sometimes they are providing patient's own registration. When the patients come to the ED, they are using a kiosk, and then also he provides the registration and then medical history, allergies, everything that can use it and also reduce workload. And at this moment, the triage nurses is focused on the patient's medical condition. So reduce the waiting time of the patients in ED. And also some of the papers that produced they implemented these kind of procedures. So one of them is decision support system tools. Also, these are computer-based systems, and some using various algorithms, digital research, and it provides to us quick decision, especially in high-risk situations. So better clinical management and some results. So pneumonia, heart failure, pulmonary embolism, sepsis, triage, with these topics, it provides to more time also used. And another one is patient tracking system. They provide you are following to the patients when they in ED, and then when they send to the patient to any diagnostic unit, any facility unit, then you are on time. You are using wristband sensors and radio for tracking tools and real-time tracking whole treatment process in real time. So you are using the time efficiently, reduce the waiting time, and increase the patient safety and satisfaction also. Another one is new, innovative also in our daily practice, telemedicine. We are using that video, audio, and or text. Reduce the unnecessary hospital visit, most important things, especially improve triage and diagnosis, and also more patient satisfaction and outcome. So some of the examples of telemedicine is telestroke system, especially in clever smart ambulances inside. And we are deciding that the TPA is approval or not without delay. So some of them we are using some ECG assessment. So sometimes they are using telepsychiatric intervention, and especially in rural areas in sepsis situation. So these are some papers and some reviews also. They are implemented, they are suggesting that use this kind of systems in ambulances, and also telemedicine system, and also 5G internet is also recommending, and also supporting for nurses education, for training, or the medical staff is implemented. Another one is portable point of care diagnostic devices. Some of them is hematological, biological tests. Some of them is some devices, or maybe we can say that nowadays doctors can carry a whole department's worth of tools on their briefcase. Portable ultrasound or echo. So we are using so much in our daily practice, in especially life-threatening conditions. So portable computers, the tomography and MRI, all that was used, because when we send our patients to the diagnostic unit, we are not following to the patients well monitored their conditions. Sometimes we are missing their vital status. So portable computers as tomography or MRI provide to us more time to more fast to evaluate for their brain, and especially for head trauma in stroke situation, reduce the time. Also, some of them is bedside diagnostic tests. We are using so many diagnostic tests. Some of them is for blood, CBC, TGC, almost blood gases, blood parameters. Also, these are all fast. We have to be use some. We are using their advantage, but sometimes some cost is important point. Need proper documentation, and we need good training staff. Sometimes gives false or negative results, so we have to be, when we are using this kind of laboratory diagnostic testing, we have to be a little bit careful also, guys. So another examples of them, these are all improved to acute healthcare and healthcare systems and acute care and also systems also. And also another examples is wearable technology. We are monitoring to the patient's vital signs, health status in real time, and with sensors or mobile applications. So we are helping detect and prevent emergencies, alert responders, provide times interventions, and then easy to use. There is no need to doctor's appointment for using it, so it's found easily to basis track and monitor a variety of health metrics. So reduce to the risk of death and burden of emergency care system wearable technologies. And some of them is early stage of sepsis. Some of them is opioid intakes in EDs. You are prescribing opioids to your especially geriatric people, and then you are using wearable biosensors to do. You you monitor to the effect of the opioids on the person. So if there is any effects, you are acting antidote also opioid set. And also that was a meta-analysis. It suggested to diagnostic accuracy of smartwatch for detecting cardiac arrhythmias, because we are almost using some smartphones, especially for following to our heart rhythm, but these application, all of them, that was a meta-analysis was here, so it suggests to us a little bit more proof of to use them. Their validation is not okay at this moment nowadays. We need more papers to say to them. It works, but their validation is not clear at this moment. Also, two speakers behind of me speak well artificial intelligence. So, but I just emphasize to ChatGPT-4 is newly announced a few days ago. It was incredible. I mean, reduced consultants times, evaluation of diagnostic imaging results, CT and especially ultrasonographic, rapid and accurate diagnosis, and then especially natural language processing system. It converts your words to whatever your words. So it's so important development also. And also artificial intelligence, there was, as you said, that was a meta-analysis comparing to the ultrasound, and the artificial intelligence is equal each other. So it's so important for children, and fracture detection also is the same, meta-analysis also. It's the same for AI, and fracture detection for human being is the same. So some of the examples was here. Digital hospitals also transform into the cardiopulmonary care. You have to use AI inside. Some machine learning for using, these are some algorithms. When you check to the literature, you can find so many papers on literature. So another one is some of the applications that in our phones, our mobile phones, our computers. So one of them is Good SAM platform. When there is a person is in emergency, someone call for help and provide them. It provides to layperson to the locations, details, and as a guidance how to perform CPR and use an EAD on public areas. Some of the examples also Babylon Health, and then BioTelesense is the same wearable techniques that use it, and also maybe you know this better than, because it's American Heart Association in guidelines from 2020, ACRS guidelines. They announced that this application is real-time CPR event tracking tool. So That's why it's coaching a kind of CPR, feedback of CPR. And some of the examples was here. My responder in Singapore is the same, it's working in same mechanism. And staying alive in Paris, similar. Significant improvement in CPR start time, defibrillation, and IRSUs, especially for medical professionals. They provide more medicines, some improve the performance of the physicians, especially in ELS, and better medical decisions. So, but the smartphone is using CPR, using them sometimes it's difficult to use for them. So these are some papers. So if you are using this, AED is more survival. If you are using this kind of alert system, your person is living more. These are all affected the safety and quality of the persons. And then we are using our daily practice is CPR is so many times. And as you see some examples here, so. But most of them, all of them is almost need more validation. So we are using some, I will share to you some real-time feedback devices. One of them is metronome. It's strongly recommended in guideline, AHA guideline, so it provides to us real-time visual feedback, deep rate and chest recoil along with the verbal prompts. It provides to us chest compression, deep and rate, and it's improved our CPR quality. And then especially when you use it, it's low skill of the bystander CPR. And then mostly this one recommending is mannequins, because they say to you chest compression rate, deep and rate with a voice, determining if full chest recoil is permitted, and noting ventilation volume and rate. These are all good mannequins. So reducing hands-off time, voice-assisted mannequins, and improve CPR techniques. So that was interesting when I preparing this presentation to you. Smart things, especially in two fingers you are using, which provides when you are infant CPR, you are providing infant CPR, you are using two fingers or two thumbs. Maybe it will be, maybe in a 5 years it will be more. We will use these kind of things. And then one other one, augmented and virtual reality is so beneficial of medical training, surgical planning, and then patient and healthcare provider education. I guess in the future, near future, maybe more beneficial. So you see here, you are using the ultrasound, seeing ultrasound pictures on the glass is so amazing, I guess. So when I saw this paper, it was so amazing, because you are using an arterial puncture to the children, and you are using glasses, and you are your success rate is the first success rate is more than experienced doctors. So these are all improving safety and quality of the patient's care, especially. And the latest one, I guess, blockchain is our newly, maybe a few years it was in our works. So reduce to the improved security, potential to improve the security and privacy of patients' data.
Doctor, you have 3 minutes left.
Yes, it's okay, thank you. Reduce healthcare streamline administrative process, and in the future security stores and share human health records. So facilitates the exchange of healthcare information between providers in any way. I mean, in hospital, EDs, when you discharge the patient. So blockchain is maybe one of the safest, it will be in the future, safest data collection mechanism, I guess. My presentation is finished, and thank you very much for all your attention.
All right, thank you very much. Artificial intelligence and machine learning, you might hear people use artificial intelligence and machine learning interchangeably, especially when discussing big data, predictive analytics, and other digital transformation topics. The confusion is understandable, as artificial intelligence and machine learning are closely related. However, these training technologies differ in several ways, including scope, application, and more. Thank you very much for your nice presentations. There's a lot of challenging heading us. For example, ethics and some judgment problems. Maybe future we're going to discuss these situations. But we, as a human being, we should choose our proper way to use this now technologies for getting future of us.
Okay, so let's thank all the 4 speakers for sharing with us the future proving of emergency medicine, as we cannot run away from the fact that we will need to use technology and AI. So let's ask the audience whether they have any questions or comments to share with us. Anyone? Anyone's already using AI? Anyone wants to share their experience? We are already into the era of ChatGPT 4.0. Yes. Can you pass the gentleman the microphone, please? This one in the front row.
Dr. Majid Thaqafi, emergency medicine from Riyadh. I found the experience not in the clinical part, still not the prime for be used in clinically for us. Still, I think the modules like the AI prototypes are not fed well the clinical data so to help us. But I found it extremely useful in the academic part of emergency medicine. When preparing actually to make studies, asking questions, clarifying research questions, and also preparing proposals, it makes the life much easier and shorter from the time of idea to the time of writing proposal to the time of doing like the true like research. I think this is at least is the prime place for us to use AI.
Yeah, thank you very much for sharing that. Certainly, it has made our lives a lot easier and a lot of things can be done faster. But in the area of clinical work, you are right. There are many issues to be considered. For example, ethical issues, acceptance issues, familiarity, training, and many other factors as well. So thank you for sharing that. Anyone else has any other questions or sharing for any of the speakers, any of the 4 speakers? Yes, please.
Okay, thank you so much. It was a nice presentation. I was very impressed with all presenter. My, worry on the other corner is what would be the community response for artificial clinical treatment and support? There is in clinical setup, we human being interact with human being with all what we have and with all common senses and so on. So the challenge is we clinician, we may, it makes life easy with, it avoids mechanical labor work and so on. But the community satisfaction and community response, there is no, I was trying to look on some of researches and there is no direct research related with what would be your anticipation on community acceptance. If the community refuses, of course, it would be out of service. The other is, my colleague was raising about the research and academic issue related with artificial intelligence. My worry is, would it affect our thinking, our processing, brainstorming, and how we consolidate things in our own view? When life becomes easier with someone did something, our brain is not processing something, or we use cooked things for what we are doing, and we are not processing and using our brain. So could it in future affect our intelligence even? Could it make us lazy, not thinking much, and so on? So what would be the future challenge for emergency related issues? Thank you.
Right, so there are 2 issues there. One is on community acceptance, and the other one is on your so-called lazy brain syndrome with so much technology. Does any of the 4 speakers want to comment on the questions and the points brought up by the audience member? Any of the 4 speakers? Yes, please.
I think we are lazy compared to our ancestors right now. So yeah, the future generations will be more lazier. I think so. The other question is whether or not the community's decisions, so first of all, our personal decisions on that is interchangeable right now. It's very wide, I think, but for right now, the community, yeah, there's two sides, surely, and it's still 50-50, but we are not very near to the real implementation of generative AI technologies. They are just one-point aim technologies we have right now. And as you see, it's not too many programs. It's still very limited. But we have to accept that we are not very far from that technologies as well. And even we like or not, it is coming. The technological advances is coming. So I think maybe we have to decide, or we have to focus on in which conditions we should accept that technology, those technologies. It's coming anyway.
Yeah, thank you for sharing that. I think certainly we're not there yet, but certainly it's good for us to think and anticipate some of these issues that we are going to encounter. Any of the other speakers want to share their views? Not really. Yes, please, Dr. Isa.
So much, thank you again. Indeed, the community will accept these artificial intelligence really, but when there is a problem within legal issues, medical legal issues, so who take the responsibility of the AI machine problem or medical errors at that time? I think there's a problem, you know. Maybe, you know, it makes easier for the evaluation of the patients, but when there is a medical problem, medical errors, who cares who cares the problems, you know? I think maybe our speakers will get the responsibility for us. So,
yeah. So who's responsible, right?
Yeah,
who takes charge and who's responsible? And you know, nowadays for research, we even have a special ethics committee for AI-related projects, for example, in Singapore. So, you know, these are certainly concerns. Any of the speakers want to take up this Dr. Isa's question? Dr. Prabha, you are also welcome to answer any of these questions. You're online, I hope.
Was covering the subject as well, the responsibility part. It's still an ongoing discussion, by the way, because no one's sure who should take responsibility for medical errors based on AI technologies. Maybe the government, question mark, the health ministry, question mark, for example, the agencies like FDA or EMA or local ones. Another one is the hospitals who accept to use that technology, who buy or pay this technology, and who will take responsibility again. For example, in hospitals, the chief or other ones, or the board of the hospitals, or the doctor who is actively using that technology. So it's an ongoing one. There is no result yet, by the way. There is I think, no filed cases right now. There is no an example of discussing that question at legal aspects yet. I hope. My opinion, I think it should be a shared responsibility, because it's a big responsibility. And for example, if it's making a good thing, a technology making a good thing, who give credits? We are taking it maybe a shared one, a small one, generally not a solid one, generally, not a solid one, unsolid credits. So if it's doing a bad thing, maybe, then we have to share it as well.
Yeah, if you take it from the WHO kind of approach, they will always have everybody take a certain portion of the responsibility. For example, there will be, at the WHO level, they will have a task force, and then at country level, governments will have to take charge as well. Like, for example, in your country, it could be your Ministry of Health, and then the other stakeholders, like the institution, the leadership of the institution, the IT department, or any other special committees that you have set up, for example, an AI committee, and of course, individuals and groups of healthcare providers, as well as patients and the community. So you can see the level of stakeholders is all the way. So everybody has some shared involvement, as you said correctly. So it's really like shared decision making. So this is also shared responsibility, perhaps. Yeah. Any other comments? Last night, while we were waiting for other questions, last night on the BBC News, there was a comment stating that people are talking to robots. There's so much robotics nowadays, they're talking to robots that some of them actually think that they're talking to a human being, and the level of expectations have to be managed. You know, it's becoming so common now. So I guess the way forward is to have a balance between the use of technology and also humanism. During the COVID period, for example, I'm not sure if any of you have read at Kaiser Permanente, when they had to break bad news of a father's death to the family, they were using virtual transmission of the message, and it came across so badly that it was publicized on the local news, and it went viral globally on social media. So that was the beginning of COVID, when we were still not used to, you know, connecting virtually. So therefore, breaking bad news and using virtual techniques, perhaps not a good thing. You know, yeah. So it's a balance between how much humanism you can add into all the technology that you have around you. Any other comments or questions on this very interesting topic? You have anything else to add?
Thank you very much for all your participations. Thanks.
Yeah, okay. Thank you very much, everyone. We can invite the speakers to have a photograph at the front.
Her şey sağlık için böyle çektik biz yola.